Legg-Calvé-Perthes disease is a condition where the blood supply to the top of the thigh bone, the femoral head, stops for a short time. This makes the bone die a little, then it slowly heals. It usually happens in children between 4 and 10 years old, and it affects boys more often than girls. Think of it like a small traffic jam in the blood vessels that starves the bone for a while. The exact cause is not known, but doctors think several things can raise the risk: a family history of the disease, a very thin build, or a hidden clotting problem that blocks blood flow. Some researchers also suspect that tiny injuries to the hip joint might start the problem, like a child falling and hurting their hip without a fracture. Typical signs are a limp that gets worse over weeks, pain in the groin or thigh especially after playing, and a limited range of motion when trying to spread the legs apart. Frog leg test. Parents may notice the child refuses to run or climb stairs. An interactive way to see this is to ask the child to sit with knees together and then slowly open them. Pain or resistance can be a clue. Doctors diagnose the disease with X-rays that show the shape of the femoral head, often followed by MRI to see early blood flow problems. Treatment aims to keep the hip joint moving and the femoral head round while it heals. This can include wearing a brace or cast, physical therapy exercises like gentle leg lifts or hip rotations, and sometimes surgery if the head becomes too flat. The goal is to let the bone remodel in a good shape before the child grows out of the hip. Because the exact cause is unclear, true prevention is hard. However, encouraging children to stay active but avoid repeated hard impacts to the hip can help. Maintaining a healthy weight reduces stress on the hip joint. Regular checkups for kids with a family history allow early spotting. If a limp appears, an early X-ray can catch the disease before severe damage occurs. Recent research focuses on better imaging techniques and biologic treatments. A 2023 study showed that early MRI can detect blood flow loss weeks before X-ray changes appear, allowing quicker treatment. Scientists are also testing bone growth stimulators, tiny devices that give gentle electric pulses to speed up remodeling of the femoral head. While still experimental, these advances give hope for faster recovery and fewer surgeries.